Friends, very happy Gudi Padwa to you all. Today I wish to start on a new series of lectures, and I will be explaining all about the various different therapies and how they work and on what diseases they are best useful on. So after that I will start talking about individual diseases and how different therapies can be used together in those diseases and how we can get the best results. So this is a new series of lectures, and I hope all of you will follow me and benefit from this. Thank you so much. I would like to start the lecture today, today's lecture, by speaking about acupuncture. So acupuncture is a very ancient system of therapy, and it has its roots basically in our Sushruta Samhita, in which Sushruta is saying that with a single needle and with heat accompanied by the needle, we can treat 1,000 diseases. So this is a verse from the Sushruta Samhita which tells us that even in those ancient times in India, acupuncture was a very important system of therapy. So then from India it went to China, just like Buddhism went to China, acupuncture and martial art also went to China, and there it flourished a lot. Whereas in India, the system of treating the body points with needles, that was somewhat forgotten for a very long time. And instead, in Ayurveda, the system of marma, which was treating the various body points with pressure, this was very highly developed. But now again, because of globalization, everything is coming together again, and acupuncture has once again become a very important system of therapy in India. And recently the Maharashtra government has given recognition to acupuncture as a system of recognized it as a bona fide system, and we are already having a council for it. And on the national level also, it has been given the status of system of therapy, independent therapy. So what is acupuncture all about? Basically, acupuncture, the whole system deals with the fact that on the body, if you can see this, there are various meridians, and on the meridians, the various lines joining the points, and these individual points, these are points of less electrical resistance. So these points are often tender whenever there is any illness related to that organ of which meridian they belong. So like we have a heart meridian, we have a kidney meridian, we have a small intestine meridian, gallbladder meridian, like that. We have 10 different meridians relating to different organs, and each of these meridians has got points by stimulating which you can change the function of the organ to which they are related. So how does all this work? So if you are aware that when there is some problem with the heart, the doctor often prescribes an ECG. What is an ECG? ECG is something that measures the electrical activity of the heart. So from this you can understand that the heart has got some electrical activity. So it is, and similarly, when there is some problem in the brain, like a person is having seizures or something, often what is recommended is an EEG, an electroencephalogram, in which the electrical activity of the brain is seen and it is charted. So from all this you can understand that the body has got a lot of electrical activity. So it's not just the brain and the heart, but in fact every organ of your body, in fact the whole nervous system works on electric transmission of electricity. So these are points of low electrical resistance. So from these points, when you puncture them or you apply pressure on them, you can change the electrical activity of that organ to which they are related. So this is how acupuncture works. Basically, we understand that there are eight different types of energies. So there are energies which are related to the Pancha Mahabhutas, that is earth, water, fire, air, ether. And then there are energies which are related to the subtle body, which is like mind, intelligence, and ego. So all these energies you can tap by puncturing or pressurizing different points in the body. So through this system, which is almost a very painless system, because the needles which are used, you can see the various types of needles which are used, they are very, very fine. They almost as thick as a hair. They're not very thick, and they have a very sharp point. So when you puncture the body, there is hardly any pain, because it's basically the needle, what it is doing, it is simply pushing the tissues of your skin aside and finding a place into it. So you can see there's no pain at all. I have just punctured a point which is considered to be one of the most sensitive points in the body. And this particular point, which is known as Hegu or Li4, is a point which is used to influence the large intestines. It is used as the main analgesic point of the whole body. If there's pain anywhere in the body, or there is any problem in the face region, this point can work on it. So as you see, there is absolutely no pain. I have not hypnotized myself while putting this needle. While casually talking, I have put this needle, and I have not experienced the slightest bit of pain. I could feel the needle going inside, but there was no pain. So this is how acupuncture works, and this is how the whole system, when we are dealing with different diseases, we select different points on the body. And for example, if we find that there is excess heat in the small intestine, a person can get a lot of symptoms of excess acidity. Small intestine or stomach, we get the symptoms of acidity. So we have points on the stomach and on the small intestine which deal with the heat energy. Simply by reducing them, we are able to reduce the heat in the body, and the acidity goes down. Similarly, when it's not just about simple things like acidity or flatulence or something, but we are able to treat even major diseases like heart attacks and epilepsy. So for example, when a person has angina and we see the pulse of that patient, we have got in acupuncture the system of pulse is used. So in your wrist there are places where we can feel the pulse of different organs. So when you're feeling the pulse of the heart, you can feel that there is what is known as the dryness energy pulse. And when you feel this, you know that this person's heart is getting less blood supply. So we are able to tap those points relating to dryness in the meridians of the heart. We are able to reduce that energy, and the person's the circulation to those heart muscles improves. Similarly, if there is a blockage in the heart arteries, we are able to treat that also, because arteries are related to small intestine as per the system of acupuncture. So we go on to the small intestine meridian and we reduce those energy points. We reduce the energy from those points which cause the blockage. For example, the blockage may be due to excessive earth energy in the small intestine meridian, so which causes the fat to get deposited. So we are able to reduce that earth energy, and we are able to reduce and remove the blockage from the heart. So in this way, I have just given a very small example. We are able to treat any kind of disease simply by understanding what is the energy that is causing the disease. For example, we get patients of epilepsy. Sometimes most of the patients either have excess of wind energy or heat energy in their brain, and there is a meridian relating to the brain called the pericardium meridian. The name is little confusing because although called pericardium, it's actually relating to the brain and not so much to the heart. So this pericardium meridian, from this we are able to reduce that energy which is causing. Mostly it is either excess of wind or heat energy in the brain which causes epileptic attacks. So we are able to tap onto those points, remove that energy, and we are able to treat epilepsy. So in this way, we are able to treat multiple diseases. For example, people having different kinds of slip disc problems. For example, they have either a sciatica, regular sciatica, which is pain going down the back of the thigh and down to the leg, or they have what is called a lateral sciatica, which is going on the lateral side of the thigh. So all these different kinds of manifestations of sciatica, they relate, either the back one relates to the urinary bladder meridian, the lateral one, which is on the side of the thigh, that relates to the gallbladder meridian. So since armed with this kind of knowledge and checking the pulse, we are able to know what exactly is wrong in the system and what is causing the problem. We are able to tap those energy points and we are able to treat those different diseases. So friends, I hope you got some idea about how acupuncture works. Actually, energy system is just one aspect of how acupuncture works. Acupuncture is a very multi-dimensional therapy mode, because it also works through other methods, like it works directly on the nerves also, and it directly sometimes works on the scalp. From the scalp, it works directly on the brain centers also. So apart from the traditional methodology of energy flow, there are other methods in acupuncture which are simultaneously active also. Nerve reflexes are active, then directly effect of local stimulation is there, endorphin secretion is there, and there are multiple ways in acupuncture, and it is one of the best systems and most simple system of therapy, which is very effective. And that is why in my own practice, although I have studied more than 20 different systems of therapy, I use acupuncture the maximum in my practice, because I find it the most direct, the most simple, and definitely the most effective. So thank you very much.